much and without much further ado, we just want to start. So today's our tech session. The last two sessions have been very, very interactive. Sometimes we don't want to leave because of the expertise of the presenters and the interactive way the participants are engaged with questions. So we're glad you are here today. So we'll quickly be going through what the course outline looks like, and then I'll call my colleague, Professor Kenneth, to do the rest of the introduction. Okay, let's go. Okay, let's do it this way. So we hope to be here just for 2 hours or less. We are planning for 2 hours less. So we are already on the coursing welcome and introduction. We'll continuously and every session will let us know what is expected. And we have 2 presentations today. The first lecture lasting 30 minutes, and then we have a testimony or a little video discussion, and then we take standing up break before the second lecture, and after that the question and answers come. And towards the end of the course, we'll be having a post-course evaluation. So let's watch out for it. I know some of us miss the pre-assessment, but not to worry. You really, really do well with the post-course assessment. So we'll explain further about this. And then there is an interactive project session that will explain more, and case studies. So we are also happy to let you know that our facilitators are curated from the best in the globe, So sit tight, get your pen, get your jotter, and then take notes, because this will help us as we develop our project, or help us to ask questions as we go along. And then this is the overall view of the whole course. We just want to help us understand the concept and be able to promote it and integrate it within whatever we are doing. And like we've been learning, it's a paradigm shift. It's a paradigm shift towards whole person health. We want to equip you with research methodologies. That's why there's a final project that you'll be engaged in. And we want to use all the tools that planet Earth has for us, media, technology, artificial intelligence, to drive this whole person health, because this is the era in which we are. So we want you to be confident and competent to be able to engage in these areas. The learning objectives are already on the webpage when you had registered, so I won't go into details in that. But understanding the thing is, take note of the lectures, listen to them all over again, think in your mind, how can I design a project that is with the whole person initiative? And 2, if I have the opportunity to implement it, where will I implement it? So let it not just be abstract. Whatever you want to do, identify your audience, identify your community, and take on which pillar, whether on care or advocacy, or you want to do research, whichever area you want to, you have the flexibility to do that. So as we go along, think about along these lines. So I just hand over to Professor Kenneth to talk about the final project guidelines. Over to you, sir.
Okay, so hopefully, thank you, Dr. Gloria. Hopefully you can all hear me.
Yes.
So basically what it is that we are inviting you to think about a project which will be an artifact that you take with you at the end of this course, where you have designed a whole person health initiative. And so the purpose of that is to draw on the content of the course and design an initiative that, once implemented, will improve the health outcomes of the community that you are working with. So you can design a project on either of one of the four pillars of focus and health that we've talked about. So, and Dr. Gloria just mentioned a moment ago. And so we have some guidelines for what to do, what to include in your project. So if you could just move towards the next slide.
Yes, sir.
Yeah, so basically to design a project that is not long, as you see the page number right there. So we are not expecting a really elaborate project with details, but we want to invite you to think about a project that um, we will bring someone who is an expert in project designs and development at the end of the course to help you sort of pin down the details of your individual project. So make sure that as you think about your project, think about clear description, the primary audience, think about scalability, and also think about if it's a research project that includes humans, you want to think about all the regulations around human subjects if you're going to interact with human beings as you gather your data. And we do have a more developed Word document that we would share with everyone who decides to carry out a project. So we have a document that we will share with you. But for now, we just want to invite you to think about your final projects as you listen to the lectures today and in the weeks ahead. So I would leave it at that so that we can transition to our presentations today. Just one more thing to mention. Obviously, we are tremendously excited that you are able to join us for this course. Hopefully, the content has been enriching. We know it's been really fascinating. For myself, there's so much to learn from it. And so we want to be able to recognize all who have attended this course. So just make sure that if you are calling in using a cell phone, just indicate your name so that we keep a record of the attendance, because we want to at some point at the end of the course send a certificate of participation to all who have participated. For those who are designing and projects, there is another phase to that, and we will be in communication with you once you've decided that you want to carry out a project. And so you would see on the website that there is a fee. There's a fee associated with that. I think we want to do it sort of $25 for those who are interested in doing a final project. And we will work with you on the details once you have determined that you want to do a final project. But for everyone who is participating, you will get a certificate of participation at the end. So please make sure that we have an accurate record of your attendance. Okay, so with that, we will transition to our presentation this morning. And so we have our first presenter today is Dr. Bilinga Tendwa, who is joining us uh, um, and will present shortly. But just let me take a moment to say a few words about Dr. Tendwa. She is a key figure in global health. I am sure most of us have interacted with her before. We know the quality of her work, so we are very excited that she is here today. She's focused on achieving health equity by addressing the impact of globalization and systemic disparities. She does holistic, individual tailored approaches to care, integrating valuable indigenous knowledge systems with modern technologies like AI, in order to create culturally informed, sustainable health frameworks that consider an individual's complete spiritual, environmental, social, and physical well-being. Through her work, research, and consultancy, Dr. Tendwa develops sustainable health frameworks that empower communities and promote equitable well-being for all. So I know I am excited to listen to her. I know she is going to bless us with her knowledge. And so without much further ado, I will invite Dr. Tendwa to um, take over and share with us her presentation.
Good morning, good afternoon, good evening, ladies and gentlemen, depending where you are at the part of the world. I want to thank Prof. Ngwa for this opportunity. I want to thank Global Health Catalyst for this opportunity. Indeed, in the shoulders of giant we stand. I've seen the previous speakers who have really walked us through whole person health, and it has been an exciting journey. I've learned so much from it. And today, I just want also to share what I've learned about just indigenous knowledge system and how to bridge the indigenous knowledge system to the modern world to see individualized care where we look at a person as a whole. I'll start with a story that I met recently. So some colleagues and I, two professors who are also very interested in indigenous knowledge system, we have been we decided to tour some parts of Africa to see how the indigenous knowledge system work. And recently we found ourselves in the border of Kenya and Tanzania. And there we went to see a indigenous knowledge practitioner, a healer, a Maasai healer called Morintat. I wish I could share the information, but I didn't ask for permission from her, so I will not share the pictures on what she's doing. She's doing such an amazing work. And it just reminded me what whole personal health is. So it was almost like a 5-hour drive from where we were at to where she stays. And she stays right at the border of Kenya and Tanzania. So you find local women coming to her. She is the first person they contact before they go anywhere else. And when we arrived at her practice, we saw over 25 women. So we arrived like at 10 o'clock and I saw like over 25 women with babies just sitting on the floor waiting to go and see her. And she was in the house. We never even really informed her we were coming. Because we were just we had scheduled to go somewhere else, but that person was not available at that time. So somebody advised us to go. So when we went to her place, she was told that visitors were out. Also, when she came to greet us, we just saw this warmth in her. She's almost like a 65-year-old lady. We just saw the warmth that was in her, the smile, the confidence that was in her. She came and greeted us, and you could hear when you look at the people, because as a health practitioner, you should learn how to read faces of people who are there, and that's what we call whole person health. If I meet you, I look at you as a person. I look at your face. Are you smiling? Are you in distress? How is your breathing pattern? How are you walking? Are you walking with a gait? Are you walking confidently? And this is the things that I was just perusing, sitting there, looking at the women who are sitting there. And from seeing that, you could feel so much worry in them. But before she came out, she had a patient inside, and that patient walked out. And when I saw the smile on the patient with the baby, I knew there was healing that took place. And when Morintat spoke to us, she asked us, what brings you? And now the two of the professors that we were with, one of them had the leg had disturbed him for a very long time. He had gone to do MRIs and what have you, and they suspected it was sciatica because they could not find anything that was really, the bone structures were nice, and so they thought it was sciatica. So he had been treating sciatica, but he could not walk properly for a long time. Even the journey to Morintat place had really caused so much pain in one of his legs. So when he saw Maureen Tatin said, he tried her, and she said, no, today I came here because my leg is paining. No, before even he said the leg, he said, yeah, he said the leg was paining. Then Maureen Tat called him, and he just touched the arm, and he was touching the arm going up, just concentrating on it. And from that, I've seen that being practiced in Chinese medicine, but I've not seen that in the African medicine. That was the first time I saw it, just from the touch of the arm. And he told him, it's one leg that is paining you. The other leg is very, very perfect. And that leg is your right leg, which is paining. So when the other professor was there, saw that, and he thought, no, I'll use my opportunity because my legs swell and they've been giving me problems. So he went to her again and said, I also have health issues. So she also said, bring your arm. So when he took his arm, he performed the same thing. And he said, both your legs have problems. From not even disclosing that to her. And she said, for me to treat you, you'll have to come here for treatment for 3 days. And what I'll do, I have to steam your feet. And after steaming your feet, I'll give you a combination of herbs that are boiled in water. And the explanation was so good. And she told us, this problem has been with you for a very long time. So it will also take a long time for me to rectify this. It will take some time for this problem to be rectified. But I assured you, in the course of my treatment, you'll be feeling better by the time you leave. The assurance was so good. So by the time, to cut the long story short, they were treated. And by the time we left there, at the end of the 3 days, they have been feeling better. And that was last week. Up to this week, they are feeling better. They now can walk. One of them could not even put on shoes. And now he's able to put on shoes. And that was just one example. Then I have another example of a lady who had just developed, a 75-year-old lady who had just developed hypertension. And he went to see the doctor. He had been going to see doctor for checkups, but this day he goes to this doctor. He gets there, and then the doctor is like, the pressure was like 163 over 93. Normal pressure should be 120 over 80. So the doctor tells her, if you don't take care of your health, one day you will drop dead. So I meet this lady after she had been told that, and she was in distress. All she thought of, my life has been cut short. My life has been cut short. So from the true practitioners, now I want us to gauge who really practice whole personal health. Go to the next slide, please. For us, and I know we have gone through this and we cannot overemphasize, for us to understand health, we need to know what whole person health is. It's a complete state of physical, mental, social well-being, and not just the absence of diseases or infirmities. Go to the next slide, please. When we look at the world, even the countries that have medical advances, their healthcare system is still burdened with chronic degenerative diseases. Why? They have the best treatment options, and they still suffer from high burden of disease because we are focused on treating just the symptoms, treating an isolated case. If I come to you, I have a kidney problem, you treat the kidney problem, you don't look at the underlying cause. You just the society now just wants to look what causes this disease, what can give relief now. How do I feel better now? But we are advocating for whole person health. Go to the next slide, please. Where we just don't look at the pillars of health. We look at the physical well-being of a person. We look at how is your nutrition? Are you exercising? Do you have sufficient sleep? Are you not in an abusive relationship? We look at your social well-being. What is your relationship between you and other people around you? Can you connect easily with other people? Can you contribute to the society nicely? How does the society take you? Has the society accepted you? How is your mental being? Can you manage your feeling? How do you manage your stress level? How do you handle your stress? Are you resilient enough? Do you have emotional intelligence to know when to engage and when to pull back? How is your spiritual well-being? Does your life have meaning? Does your life have purpose? Do you feel connected to others? What are your values? That's how whole person health look at health. Go to the next slide, please. You know, it reminds me of Isaac Newton when we speak at whole person health. When you look at all Isaac Newton, before he made any discovery, his body, his mind, his feelings were intact. So he is the one who discovered the universal law of gravity because he was in a state of paying attention. When you are your mental state is not good, you cannot pay attention. Worry will kill you. You will be worried most of the time. You can't even be in a space where you can discover or solve problems. And that's why we are looking at whole person health. You know, when Isaac Newton was sitting, just minding his business, sitting under a tree, an apple, and what an analogy. It's not an analogy, what a discovery. He was just sitting under a tree. And today we happen to be talking about phytomedicine. That is medicine from plants. So you're sitting under a tree and an apple falls. And he knows, oh, why did this apple fall? Why did it not go up? Then he discovered the force of gravity. We are saying, as person, when we look at a person holistically, if your body is in tune with your mind and your environment, you can solve problem, you can make discovery, you can help me, you can help those who are around you. But if you are not, then you'll be in constant worry. And that's why we are advocating for whole person health. Next slide, please. When we look at whole person health, it looks at the root cause. It looks at you as a being who is so different and unique from the other person. It looks, when you come to us, we want to look at you. We want to see where did it go wrong and what best care can we give you so that you can restore your body function. It's a partnership between the healthcare provider and the patient. Go to the next slide, please. And when we look at disease, how did it go wrong? Where did it go wrong? We look at life as a basic unit, the cell that makes life. The cells, our life is just a combination of very many cells in us. And these cells work in communication with its electrons. What are electrons? Electrons are those things like, when we talk about oxygen. When you talk about oxygen, we talk about the electron, carbon dioxide. I'm just trying to break it so that it can be understood across the board. So something like carbon dioxide, carbon monoxide, carbon dioxide, the air that we breathe out, it's just made also of electrons. It could be positive or negative electrons. And these electrons are there in our life to relate to each other so that life can move on. But once this electron must be attached to something else for it to be complete in a cell. But we find in a cell, when we have an electron that is moving, it's very dangerous. And that is what we call oxidative stress. This is electrons in our bodies that need to attach to another electron so that our bodies can function nicely. When we look at the cell has a mitochondria. The cell has the DNA that defines who we are, that produces the things that make us who we are. that makes me speak right now, that defines my mouth. But when these cells have species, you picture a child, who a 3-year-old child in a room of so many toys, and they're playing with these toys. They have no specific way of playing with these toys. They're just bombarding on each other. So when we cause this stress to our body, it leads to dysfunction. That is, the electron that is left sparingly, it will bombard in the cell, and it will lead to the dysfunction of the cell. And the oxidative stress will lead to the destruction of the cell, and it will lead to inflammation. That is, the body will try to protect itself from not to function properly. And as it's trying, the fighting between the body to restore its function and the other things that are going wrong in the body causes your body to be inflamed. It causes your body to feel pain. It causes metabolic dysregulation. And when we look at these things, we look at the social determinant of health. How do your environment function? Are you the one, like, do you introduce toxins into your environment? Do you plant many trees that will help us produce oxygen and take out carbon dioxide? These trees will store the carbon monoxide and carbon dioxide, sorry. And when they store carbon dioxide, an issue that we called carbon credit. It protects the ozone layer. So if you're protecting the ozone layer, if I'm protecting, we are living in harmony. So we are looking at the body not in isolation. We are looking at the body on how you function, on how I function to make the body functions properly. Move to the next slide, please. But when it goes wrong, how do we fix the body? Then comes the issue of phytomedicine. This is just, phyto means, it means in Greek, it means plant. That is just medicine from plants. How can we use this medicine from plants to fix our bodies? This is an art that has been used for so many generations. A drug like quinine came from Chinese medicine. It was borrowed from traditional Chinese medicine, a plant called cinchona. And this plant produced quinine. This quinine has been used as a first line of treatment of malaria for so many generations, for so many years. Now we see plants, knowledge from plants. It's very important for us to know how they've been used in treatment. In phytomedicine, we look at a body as a unit that has the ability to heal itself. All we need to do is just assist this body to heal itself, to protect itself, to regulate itself with what is around us, medicinal plants. Move to the next slide, please. And when we look at phytomedicine, it has so many branches. The modern phytomedicine, back then, we used to have this indigenous knowledge system that will transition, that will help us heal the body. When I look at Morintat, I see that indigenous knowledge system, and what she uses is purely phytomedicine, medicinal plants to restore the body function and the warmth, and just looking as a person as a whole to restore the function. Then how do we transition this to validate this in science? Because we want to improve on the means that we had back then and transition to the modern means, bridging the two so that we can obtain this holistic health that we are talking about. We look at, when we modernly, we look at pharmacognosy. That is just studying the chemical and the biological properties in plants and how they can be derived from these natural products to help our body. We're looking at phytochemistry. We want to validate the indigenous knowledge system and the what from the science. Science just wants to prove what the indigenous knowledge system has been doing. That is the botanical pharmacology. We learn from them and we see how we can improve them in pharmacognosy. And we also see the modern clinical phytotherapy. That is how the modern way of using plants, this is called Western phytotherapy, how we can use the diagnostic tools to improve the whole person health, borrowing from the indigenous knowledge, but also improving on it, on addressing health. And for now, we are also advocating for this clinical phytotherapy to also be incorporated in our modern health, because most of our doctors are not taught about this branch of health. And we have been, the WHO has ascertained that 80% of the population use medicinal plants to treat themselves. And if there's 80% using it, surely as the modern practitioners, we need to embrace, we need to learn, we need to know how these drugs interact with the drugs that we are using, modern drugs that we are using, to see that health for all is better. The next slide, please. We also have regulatory bodies in the phytomedicine department to see that whatever is being practiced is in line with the scientific world. It's in line that we do not use toxic substances on people. And what these regular bodies do is just to see that, whatever practices are borrowed from indigenous knowledge system do not affect the whole person, do not affect any person health, the regulatory body. So we see the issue of whole person health is not about one person. It's about regulatory bodies. It's about that citizen who has information that has not been verified scientifically and communicating that information to the scientific world. The scientific world takes this information and see how they can improve this information for the betterment of a person's health. Look, the next slide, please. They look at the phytopharmaceuticals in these plants. How can we use the phytopharmaceuticals in this plant? That is, how can we obtain medicine from these plants in the modern way that can be distributed to help other patients who are not found in this locality, that can be preserved and be used with other patients in another locality. And to me, when I look at that addresses, it's not just addressing the disease in this area. If I know how practices in this area can transition to other practices and they can be married together in order to make health better for all, it's equitable health for all at a very affordable prices, that talks to me about whole person health. Next slide, please. Whole person health recognize the fact that you exist because I exist, the paradigm of Ubuntu. So in phytomedicine, we look at a person. When I look at the two practitioners, the doctor who treated the lady with hypertension, and I look at Morinkat, I ask myself, who really performed healing? Who really performed healing within the two? Who looked at as a person, as a whole person? Who practiced Ubuntu? Who explained to the patient that, when I take this drug, I'm not using, in phytomedicine, we do not just use one type of herb. We use a combination of herbs, and this addresses different aspects of health. And that is what Morintat has been practicing, and that is what the information he passed to even the patient. He told them on how to act, on how to use this drug, and he told them on the why they are doing what they are, and why they are doing the action they are doing in the body. So we want the government to also look at the indigenous knowledge in phytomedicine that is within the locality. They have not been documented. We want to document them in order for us to help the whole person, to look as a person, as an individual, and just borrow from what they are practicing and transition it into the modern world to see that, every aspect of health of a whole person has been addressed. It just doesn't look at a person just as an organ, like one organ, as an isolated case, one part of the body as an isolated case, but it looks at the body in totality. Move to the next slide, please. When we look at the root cause of disease, the root cause of disease is accumulative of so many things. That is, I talked about oxidative stress. I talked about how the body becomes inflamed, and then there's metabolic dysregulation. What does it result to? It results to diseases like type 1 diabetic. It predisposes that genetically to these diseases. It brings diseases like it compromises the intestinal barrier, and it allows, oh, like I'll talk more about it in my next slide. It allows things like multiple sclerosis to emerge. So, it's a combination of so many things that just comes from the inflammation of the cells and our predisposition, genetic predisposition. So if we are treating that in phytomedicine, we have to address the root cause in order for us to treat you properly. If we do not understand the root cause, then we are not gonna treat you as a whole person, but we're gonna give you fragmented treatment. The next slide, please. When we have addressed the root cause, we look, let's say for an example, this is the leaky gut, the gut dysbiosis. Our gut is made up of bacteria that protects the lining of the gut. And this is so big in phytomedicine. In phytomedicine, we want to consider what goes in and what goes out. And in our lining, there's a barrier, a tight junction barrier. And once, which is protected by bacteria that are environmental friendly in that area, in the area of our digestive system. But once toxins come in, once we disturb this barrier by taking things like excessive antibiotics, it kills both the good and bad bacteria. So when it kills this good and bad, it causes the barrier to uplift and allows toxin to go to our bloodstream. And most of this toxin is the onset of other diseases. So if we are addressing anything in phytomedicine, we have to address where the problem came from. If the problem came from the gut, we have medicinal plants that are used in the gut to heal us and to restore health. Go to the next slide, please. We look at the whole things. How can we use, where in the system does the inflammation come from? Where does the metabolic disruption arises from? What caused the metabolic disruption? But how can we address this? How can I use you? If you're a child, how can I talk to your parent because you can't administer health on yourself? How can I talk to your parent to rectify this in you? If you come in a debilitated condition, how can I address the person who brought you to understand health? That is the concept. That's where the Ubuntu comes. How other people can help you, how other people can come in and help you restore health, your own health and our own health as a community. Let us move to the next slide, please. When you come to a phytomedicine practitioner, they will look at they will take intensive history. They want to know your lifestyle. They want to know how you behave. They want to know how is your family structured, how many people are in the family. They want to know your social being. They want to know the environment you are living in. They want to know if there's any underlying disease that you are dealing with that could be the cause of what we have right now. And they give advice in all aspects of health. As I said earlier, in phytomedicine, we cannot just treat the symptoms. We want to go to the cause. We want to look, is it nutrition the cause? We give you advice in proper nutrition. We give you advice in exercise, mindfulness, meditation, and then we come to treatment. And after we have addressed the root cause, looking at the root cause and then addressing it in phytomedicine. Go to the next slide, please. When we look at, when you come to us and we have ascertained the root cause, we look at the best medicine to give us. And it's a combination of several plants. And these plants have what we call secondary metabolites, the nutrients the plants have taken from the soil, and they have used these nutrients to convert it to something, to a chemical that can be useful in our body. We have different classes of these chemicals. We have alkaloids, we have phenolic compounds, we are also called flavonoids. Some of you have come through these terms before. We have terpenes, we have glycoside. So depending on your ailment, we will, as a phytomedicine practitioner, they'll look at a plant and they'll look at the content of this plant and they will look at how this plant can act synergetically with other plants to concentrate their use in the body. So I will not, or to make sure that it's available biologically in the body, that the cell can take them in. So we do not use one combination of drugs, we use several combination of drugs, and this just increases the bioavailability of this drug in the body. Move to the next one, please. They look at the pathway that has been disrupted. So in phytomedicine, if you come to me, I'll look at, by looking at the root cause, I will look at which path in the body, because even our bodies work in paths. Like there's a path in the body that controls every function. And if a function goes wrong, I have to go and address that path, that the function has been disrupted. Here I've given just but a few parts in the body which can be addressed and which diseases may arise in that part. And once the disease has arisen, then how I will look at the phytomedicine that can address which chemical compound in this phytomedicine can be used in this part in order for it to restore the body function. But we know also it's not only one part that is affected, because if one part is affected, if my kidney is affected, my mental state is also affected. So you may come to me with kidney problem, but I will not immediately address your kidney problem depending on how far it has escalated. And that is just an example I'm giving. I'll first address your mental state. So you'll find that if you go to a indigenous practitioner, they'll sit with you, and sometimes even before they start attending to you, they'll give you tea, because once they hold your hand, they can see a state of panic. We have phytomedicine that are calming, and they're called calming drugs, because they'll make you calm down. They'll reduce your worry. And before you are even addressed, that is what will be addressed first. I'll address your mental state, then I'll address the other underlying condition that you have. Move to the next slide, please. Sorry, I'm running out of time, because that's why I'm rushing. The issue of phytomedicine and disease is very wide. I'm just trying to condense them in a short period of time. So when we look at, for instance, when we look at the metabolic pathway and the possible disease that could come from the dysregulation of the metabolic pathway of drugs, we have issues like the cardiovascular disease, heart diseases, we have diabetes, we have cancer. Then if we have these diseases, how can we use phytomedicine to address this? We use different types of phytomedicine. You could be presenting with cardiovascular disease, diabetes, and at the same time you have cancer. We can have a combination of 4 or 5 different medicinal plants that will address each of these systems together, but also separately. So, and these drugs, in one phytochemicals, just one drug, you'll find that it has different phytochemicals that can address all these diseases. So I look at that phytomedicine that can address all these diseases, and look at other phytomedicine that can add synergetically in this part and also in other parts, just to restore the body function. Move to the next slide, please. So when we look at phytomedicine, let's say, for instance, a person presents with breast cancer. So when a person presents with breast cancer, there are so many things that I want to address in this person. And I've given just 3 combination of drugs that could address this holistically. First of all, I've used turmeric, which is a common drug that we use, and it has curcumin. Curcumin will inhibit the pathway shown, and also I have grapes, which has a chemical called resveratrol, which also acts in another pathway. But all these pathways act together, and phenolic compounds in a compound the mistletoe. You all know the mistletoe. It's very rich in phenolic compound that is very nice anti-cancer drug. And this is just the way they act. They reduce tumor to 2 to 5 times tumor reduction. And it drops the toxicity by 25%. And the quality increases the quality of life significantly. And this are just studies that have been done. And I've given at the end of the slides, I've given references to these studies that one could go to and just read what the trials that have been done in these studies, and it has been seen that it increases the quality of life. So if a person comes to me with with breast cancer, I'll want to manage the stress that comes from it. Some of the drugs that will address this stress are like lemon balm and the drugs that I've given here. And I think I can give this slide so that we can go through next time, because my time is over. Move to the next slide, please. And these are just some also of the examples that have been done just to clear. I think this slide is cut, just to clear, to see how this medication can work together just to bring, and the milligrams that can be given if you come to a phytomedicine practitioner, that's how they can attend to you. And I've also given the rationale behind it. And I think because of time, I'm just wrapping it up. Go to the next slide, please. And as we say, we as the phytotherapist, a person who look at a whole personal health, what you do, you want to know what is being done in other nations and work together. The primary healthcare studies, we want to see the evidence that is in this primary healthcare. We want to see what the laws that are there. How do we marry this law? How do we, what evidence do we have in this phytomedicine? But how can we put this together so that you can have universal health coverage for health for every person? How can we incorporate phytomedicine to normal practice? Move to the next slide, please, like the conventional medicine, just for the betterment of the human health. And with that, I say thank you so much. For more details, you can contact me and I can explain more using how we practice phytomedicine. Thank you all. Right.
Yeah, thank you so much. That was wonderful. That was wonderful. You're just trying to marry everything together the way it should be. We appreciate you, ma'am. Thank you. All right. We should be heading to we'll take the questions at the end, please. So please drop it in the chat room. And we should take a short video session as part of the break. You can stand up while watching as part of whole person health. And then we'll come and take the second lecture. Thank you.
Hello all, my name is Riaz Khan and good to be with you. to share some thoughts from Islamic perspective. Islam is all about whole person health. The Quran is a healing for those who believe in it. It cures people of intellectual, spiritual, social, and cultural illnesses which cause mental stress, worries, and anxieties. Islam emphasizes a balanced and a steady way of life that integrates physical, spiritual, mental, and social well-being grounded in reason and sense of accountability. The whole person health is rooted in of body, mind, and spirit of a person to function optimally. Physical well-being supports moral and intellectual functions. Human body, with all its capabilities, is a trust. Neglect of health is subject to accountability. Human being is an extraordinary, exceptional, complex, and dynamic living creature. His creative, cognitive functions, intellectual faculties, freedom of choice and action, and his creative instincts for exploration make him unique. His view of the universe around him and his understanding of his role in it make him mission-oriented and accountable to his creator. The sense instilled in his conscience guides him to differentiate between good and bad. Thus, man is not merely a physical entity needing food and drink for survival. Islam considers him as a multidimensional whole person and cares for his total well-being. A multitude of
I think the video is frozen. Is it?
Sorry. Yes, it is. Can you refresh it or move it forward a little, Mr. Aish? Thank you.
for his total well-being. A multitude of
Yeah, since we are having difficulty with the video, we will proceed to our second presentation with Dr. Saida. And Dr. Saida is someone that we all know, and she is an instructor. This is the information I'm getting. I hope it's really up to date. Radiation oncology at Harvard Medical School, and she specializes in immunology, molecular biology, cell biology, cancer biology. And as we will find out in her presentation, she's doing amazing work to advance research and the implementation of whole person health. And so I am excited about her presentation. And so we'll turn it over to Dr. Saida.
Thank you. Thank you, Kenneth. Ayush, can you share my updated slides, please? Thanks. So the area of discussion today is phytomedicine and indigenous healing system. I will go over next slide, please. After great presentation by Dr. Bilinga Tanwa. So I will confine my presentation into cannabis and other flavonoids for cancer care and we will share also some of the work we are uh, doing in the research for cancer care. Next slide. Okay, so what are the flavonoids? First, flavonoids are plenty in the food. All fruits, vegetables are the source of very good source of flavonoids. But as I can describe, these are type of polyphenolic compounds, natural sources, plant-based sources, and these are potent antioxidant. These are anti-inflammatory agent and anti-cancer effect and safe for the body. Next slide, please. So their chemical structure, you can see the chemical as you look into the chemical structure. These are 15 carbon phenopropionol acid, propanoid acid, where it forms three cycle, but we are three rings, three aromatic rings, but these among them, the A and B aromatic rings are linked by a C heterocyclic pyrene ring. So these A and B rings are very important here. All the flavonoids will have ring A and B, and they will connected with different type of Byron rings, which is C. So we will go to our next slides. Based on their chemical structures, degree of oxidation and linking chain in as the unsaturated flavonoids, these are classified into mainly 6 or 7 types of different flavonoids. So we can start as the first isoflavonoids, then flavonols, flavonol, flavones, and anthocyanins. So these are where all of these must have A and B ring, but they have different types of linking chain attached with these A and B rings. So next slide, please. So based on these, I want to show you some of the flavonoids which are different types of flavonoids in different uh, types of foods. For example, these are few examples I'm discussing today. So like flavanols, which are abundant in some kind of vegetables like tomatoes, lettuce, some fruits like apple, grapes, berries, and some spices like garlic, scallion, onions, etc. The flavonoids, which are more abundant in parsley, thyme, celery, flavonones, which are more in citrus fruits, and isoflavonones are more abundant in soybeans and other legumes. So these are very good sources of flavonoids which we have consumed naturally every day. If we can have fresh fruits or vegetables, these we can gain abundance of flavonoids every day. Next slides, please. So in here I would like to show you more related to cancer care. If you see the first line with the flavonols, which have many different varieties of flavonoids under this, and it are the major sources are the chocolate, green and black tea, beans, cherry, as I mentioned little before. So these are very good sources of these flavonoids laws, and these the one which we have here, these are not only the sources, we have more fruits and vegetables are under this flavanol. So how what it does to different cancers. So it works, it shows some anti-cancer properties, mainly to the oral, rectal, and prostate cancers. So next slide, please. So flavonols, which also shows different varieties of flavonols. I'm not mentioning all the names here, but these are also abundant in different fruits and vegetables like parsley, celery, Brussels sprouts, orange juice, grape juice, milk, and red onions in everywhere. So these are also this shows these flavonols collected from these vegetables or fruits also shows some anti-cancer effect towards lung cancer, leukemia, stomach, colon, thyroid, oral and laryngeal cancers, including breast cancers. Next slide, please. So the anthocyanate, which also shows have some other uh, flavonoids under this name, under this group, and abundant in blackberries and other berries. Those shows colorectal cancer preventive or cancer, anti-cancer properties. Next. The last example here also isoflavonols, which shows uh, abundance in soy flour, soybeans, soy milk, etc. Has also shows anti-cancer effect towards the breast cancer, prostate, colon, kidney, thyroid, uh, cancer, etc. So this is some of the examples. I was mentioning that these different types of flavonoids has a propensity to heal different type of cancer or prevent different types of cancer. Next, please. So today I will discuss some of our research works, ongoing research works with flavonoids as an anti-cancer drugs. So first I'm gonna discuss about the cannabis. Let's go next slide. So cannabis is a flavonoid. Cannabis is group of plants. These are from Cannabaceae family. There are so many varieties of cannabis strains, which is maybe around 700 or more. So these cannabis are abundant in everywhere in the world, and those plants have so many different chemicals. So some of the chemicals shows very cancer specific uh, very potent anti-cancer activities. So understanding these different types of cannabis chemicals from and the cannabis plant actually will help us to get some anti-cancer activity or symptom relieving activities for cancers and many other diseases. Next slide, please. So in the American Cancer Society, it's also mentioned that people who have certain symptoms of cancer or side effects of cancer treatment might benefit from using cannabis. When effective, it can improve quality of life and reduce the number of emergency room visits for things like dehydration due to nausea, vomiting, and uncontrolled severe pain. This is mentioned by the American Cancer Society, where they are showing more the palliative type of effect the cannabis is showing currently, but the research are going more deep into it. They are finding more directly treating type of treating effectively but in different cancer model. So can I see the next slide, please? So here we did some research, our group. Uh, it says it shows that when we use cannabis, cannabinoid is specifically for which our other name is CBD. This shows some anti-tumor effect in animal studies where we shows in the lung cancer and the pancreatic cancer model. You can see the tumor volume decreased when we use CBD and the lifespan of the mice increased. This has been published in a referred journal. Let's go to the next slide, please. So CBD is also important for palliative cancer care. These are reduce the symptoms and its management of pain. It also used for nausea, vomiting, as I mentioned, and also it helps in appetite stimulation. Can you next slide, please? So next, I will discuss about another flavonoid which called caflanon. Next slide. So cafranol is another flavonoid which another name called FBL03G, and this is a very small molecular weight flavanol which has the good advantage for getting into the cell to perform its work. Next. So the caflanol, this also shows that in lung and pancreatic cancer model, they are potent in the treatment, especially for the pancreatic cancer cells. So in this study, we observed that adding some radiation or other immunogenic agent to the cafranol further reduces the cancer size or volume and increase the survival duration. Okay, next slide, please. So this flavonoid cafranol also not only shows that it reduces the tumor volume, but also demonstrate they have they have the property for pain relieving. So we did some study in mice and we used this cafranol intratumorally for treating the cancer related pain and observed the pain behavior of the mice, and you can see on the right graph the bottom mm, the blue curve. It shows that the blue line identifies the treated mice where the clefranol actually reduced the pain related behavior of the mice compared to the vehicle treated, the red line mice. Thank you. Next slide, please. So next, I will discuss about another flavonoid, which is hesperidin. Next slide. So hesperidin, we used hesperidin in our animal study also, animal with lung cancer model, but in nature the hesperidin is abundance in citrus fruit, uh, which are the potent antioxidant, anti-inflammatory, and neuroprotective um, in nature. And these are more abundance in oranges and lemons like this. And this has some other properties also for anti-diabetes, reducing that blood sugar and preventing cancer. So next slide, please. For our study, we use hesperidin as a hesperidin nanoparticle model, and then we treated for lung cancer, treating through inhalation method. And in our treatment, we observed that adding the hesperidin in the treatment, it definitely reduced the tumor volume compared to the controlled mice, and further adding another immunotherapy, adding it further reduces the tumor volume, where you can see the red, the more red is bigger the tumor, where we do see in the control mice, and for the treated mice we do not see that much, and you can see the dots. So in the picture, the upper panel is, I think I'm missing one picture. So anyway, so the upper panel shows the treated mice with tumor on day 0, the day we treated, and the lower panel shows the treated mice um, on different days, because day 10 for the control, where all the control mice actually died, all have to euthanized, and day 21 where all the HNP or hesperidin nanoparticle treated mice were euthanized. And same thing with the anti-CD40 on day 21, where all the anti-CD40 mice, tumor-bearing mice, has to euthanize. And on day 21, the you can also see hesperidin plus anti-CD40 mice pictures. You don't, but here you can see some of the mice already the tumor disappeared, and some mice has small dots. So this definitely shows this hesperidin has a anti-cancer activity or anti-cancer properties, which reduce the tumor growth and increase the life expectancy. And on the top of this, the graph, you can see that when we use hesperidin plus um, immunotherapy, the survival was 300 days compared to the control, less than uh, around 10 days or so. So the hesperidin definitely shows hesperidin definitely demonstrate anti-tumor activities, but adding some other adjuvant like immunoadjuvant further enhance the activity of hesperidin, showing in this study. Next slide, please. So next I will discuss about another drug which called Linebacker, which is a myricetin derivative. Okay, next slide, please. So in this slide, and I can see you, this is a synthetic uh, preparation of myricetin. because myricetin already approved by the Food and Drug Administration to mention as a safer to take this as an with the food or any other supplements. So this linebacker is also a small molecular small molecular size flavonoid, which is easy to be taken up by the cells. So we did a very elaborate study with Linebacker showing with different adding radiation or and also adding immunotherapy with Linebacker. So in this in gist or in summary, this Linebacker also shows anti-tumorigenic activities, but adding radiation or or adding the immunotherapy anti-PD-1 further increase the survival duration of mice in this case. So next slide, please. So we discussed that these flavonoids have an very excellent prosperity for their anti-cancer effect, because these are the preliminary studies confirm that these different types of flavonoids shows their anti-tumorigenic activities. But for reducing or getting better activity, we may also deliver them in different way, like for sustained release or intratumorally or inhalation. So our in the left side panel, you can see some of the way we can use flavonoids loaded into a smart biomaterials format, and which will deliver intratumorally and allow the drug to release slowly in the tumor microenvironment. In the right, you can see these flavonoids can be generated as a nanoparticle format, and it can be inhaled. Here you can see these mice are inhaling these nanoparticle in the environment where the nebulizer released as a aerosol format into this chamber. So next slide, please. So next, I would like to discuss a little bit about how these why these flavonoids shows that anti-cancer effect. So there are some characteristics how the cancer cell should be um, treated, or if it doesn't treat, what happens. So there are multiple ways cancer cell can be treated, as some drugs directly can kill the cancer cell. Some drug may reduce the blood flow to the cancer, so the cancer cells doesn't get enough nutrition, or sometimes some drugs may reduce the spreading of the cancers. So different drugs can work in different way, but in flavonoids you can see the combination of many uh, methodology works together. So most of the flavonoids works as an anti-apoptotic agent, which actually induce cancer cell death directly, and also anti-proliferative agent, which reduce the cancer cell growth, or another way we can say growth arrest, so the cancers cannot become bigger. Anti-angiogenic effect, which actually inhibits the tumor blood vessel growth, so the tumor doesn't get enough nutrition. And the last one is anti-metastatic, which reduce the cancer spread. So these are the main four criteria, way which a cancer can be um, cancer can be treated or reduce the growth or make it less vulnerable by anti-metastatic properties. So next slide, please. So there is some more elaboration with more medical terms with this. So here, these different type of mechanisms, how it works. So like for in the right side, how the apoptosis work by by increasing some anti-cancer gene like P53 or caspase, or blocking some gene like BCL2, and how does the anti-metastatic action works. It increase the e-cadherin activities, which makes the cells not to go to different blood vessel for metastasis, and also uh, it reduce the resistance drug inhibition or autophagy. The autophagy means that the cancer induce kind of uh, system where the cancer cells kill themselves. So you do not. So this is a kind of apoptotic behavior. Also, it can do some cancer-related DNA damage and and increase stress, oxidative stress, and cell cycle arrest with the NF-kappa B pathway, and proliferation of inhibiting um, telomere by H-TERT, and angiogenesis inhibition by BGF, and other genes. So these are some of the gene. Mm, so these flavonoids, which are the excellent source of fruits and vegetables, are very important, shows very important mechanism of controlling the tumor growth with the very molecular level using the gene upregulation and downregulation. So next slide, please. So so after all these, there are some clinical trials ongoing for cannabis and some other also phytomedicines. So I'm just giving some examples. So currently there are some mainly two studies going on, but maybe I collected this couple years ago. Maybe they are doing more. And then next slide. And that's also exciting that one of our flavonoid studies, which is the cafranol FBL03G, she got FDA approval for the clinical trial for pancreatic cancer patients. So next slide. And thank you so much for listening. And I believe you get some short information, but very exciting information for some flavonoids.
Thank you indeed. Thank you indeed, Dr. Saida, for that. Wonderful, very detailed presentation about flavonoids. There's so much content, good content there. It certainly made me want to go look at the pantry to see what kinds of foods I have in there, because it's like, wow, I need to update sort of the diet. So thank you so much. We do have time for questions, and the number of questions in the chat So I will try to toggle through the questions and go back and forth between our two presenters. And so I will allow Dr. Saida to take some time to scroll through and just see some of the questions. And so we'll begin with Dr. Tendwa. And first of all, just to say, as you all can see, there is real appreciation in the chat for the content that you have presented today. And so appreciations coming in. And then there are a few questions here that I would like to invite Dr. Tendwa to speak to. One is about, I think, generally about the question of um, um, plants, creation, the environment, and its connection to religious texts, whether it's for Christians in the Bible, or Muslims in the Quran, for Jewish people in the Bible as well, but also religious communities. You started out talking about someone that you went to meet them in the ecosystem itself, and there's a kind of spirituality that accompanied that visit. So the question here is, Will is asking if you could just briefly comment on the ways in which religious text might help us sort of develop a certain sacred attitude towards nature itself, and how they contribute to our own healing. That's from Wilfred, and then Aquen wants to, if you could just talk as you answer that. Aquen wants to know if there are some statistics that you might have about the effectiveness of this engagement with phytomedicine. Dr. Tendra.
Okay, thank you so much. Let me begin with the question of how the Bible explain about phytomedicine or herbal medicine. When we go to the book of Genesis 1:29, where God tells us, I give you every seed-bearing plant on the face of all earth, and every tree that has fruits in it, they'll be yours for the food. This tells us, when we take the herbal medicine, there's a nutritional value that is used to build our body. You can see even from the presentation that has been, the Saida has just presented, you can see the rich food, the colorful food that has flavonoids. And these flavonoids are used to fight cancer. And when we marry this to what the Lord told us, let us eat these fruits for the betterment of our health. Also in the book of Ezekiel 47:12, it says, fruit trees of all kinds will grow on both banks of the river. Their fruit will serve as food and their leaves for healing. So wherever we are placed, we believe as Christians, within that locality, there's a tree that can be used for your healing. And true to say, the more I interact with indigenous knowledge holders in phytomedicine, you find that they don't go far to look for healing. If they want to treat the locality, the primary health care, they'll just go to what is in their backyard to come and use it for treatment. And also, lastly, in the book of Revelation 22:2, it says, on each side of the river stood the tree of life, bearing 12 crop of fruits, yielding fruits for every mouth. And the leaves of the tree are for healing of the nation. This just relates also to the book of Ezekiel. With the issue on phytomedicine evidence, now there was so much that was not done in terms of evidence, because the indigenous knowledge holders, nobody wants to, they were left on their own. These are the people who don't know how to document the evidence that are in there of what treatments that are used. But now you see, now the scientific community has embraced this knowledge. And I just gave an example of quinine. What evidence do you need from quinine? Quinine has been used, has been tested time and again in treatment of malaria. And this is obtained from a plant called chicona. Artemisia, artemisinin for treating malaria. It has been obtained from a tree called Artemisia. That is the evidence that is in there that we can hold on now. Also, we have just seen what Dr. Said has just presented right now, the flavonoids, the evidence that is there in the mice. That is the evidence that is just being presented now. And there's so many evidence that have not been documented. And that's why we say the Global Health Oncology University, together with the Global Health Catalyst, are moving this thing from farm to bedside. We have a concept for phytomedicine from farm to bedside. We want to monitor how these are produced in the farm, how they are taken to the laboratory, and how they can be manufactured into drugs that can be evidence-based drugs, even up to the clinical trials part, until they
Yeah.
are taken to a patient in the bedside.
Hmm.
So yeah, that is
Yeah,
what
thank
we are
you.
doing.
And so one more for you there, and then we'll go to Dr. Saida. And it's a question from Oscar um, who is asking, we know that the pharmaceutical industry has a strong grip on drug production. So what strategies are being considered to overcome this hurdle to enable phytomedicine to have a prominent space in the health industry to enable better health care for all?
Oh, that's a good question. I've come to, I've worked for South African Health Product Regulatory Authority, which also incorporates the phytomedicine. And we have seen many pharmaceutical industry actually are producing phytomedicine that they want also to be registered, that needs to be scrutinized. So they have embraced, apart from they have embraced the phytomedicine industry. But we also have other companies like Flavocure Biotech, which just specializes in producing plant-based medicine for the community. So we have upcoming companies that are embracing also phytomedicine and are producing drugs from it. So it's getting there. It's slow, but it's growing at a very enormous pace. And I think it will catch up everywhere. Thank you.
Mm, thank you. Dr. Saida, there's a question about um, how can we bring back these traditional healing cultures into respective whole person health within the current medical practices? Who should pay for these services? There's also a question about from BK Kim. Cannabis is prohibited in many countries. How about other side effects at the anti-cancer dose range?
Yeah, thank you for these questions. These are very interesting and valid questions. So, last and mm, so first start with the first questions, how we can bring these treatment in our platform. These are still ongoing in research, and most of the drugs are not approved by FDA, but some are already done because, as I mentioned, the myricetin, which is an FDA approved for not for the drug, but for having nutritional substitutes. So these are some, and also I mentioned that the flavonoids are plenty in the fruits and vegetables. So the first thing we our we, the researchers has to move fast to do more research to bring this to the clinical trial where we can see how it works, and then it can be given as a treatment regime with in combination with other drugs as we treat other chemotherapeutic or other agents. But side by side, I would say that general people can learn or go over to learn more information about natural flavonoids and try to consume more mm, flavonoid related fruits and vegetables, and with keeping the quality of it, so that this can assure some preventive effect for developing cancer and boosting the immune system, so the cancer might get killed by our own body before it flare up. So next question is, the cannabis is prohibited in many countries. Yes, that's true. Actually, at the beginning, cannabis was prohibited in all over everywhere. So now people are getting more and more information, and even in America, they are at the beginning, there are few states allowed the cannabis. Now it's almost almost getting in the process for federal uh, um, approval. So I would say that people has to work with the local government to educate them how the cannabis can help. It doesn't produce any toxicity. It doesn't kill the people for overdose. So there is more benefit of cannabis. Uh, Even it has some psychotic effect, but this is not um, very toxic to the body. And however, the side effects at the anti-cancer. So the dose range, since telling that they started few clinical trials, but I in human. So these are those when they release the information, we'll learn more about the doses, since it's not yet came as a source of medicine to the for the human as for treatment. So those are not confirmed yet. Maybe in few years, this will be more information will be available. Hope so.
Thank you. And so there's a question that I imagine both of you can take that. It's about from where do these plant flavonoids for phytomedicine differ in their potency or effectiveness depending on where they are grown or processed? If so, how can we control? So I imagine that both of you would want it to take that question. Is there something here to think about in terms of production? So, Dr. Tendra, you talked about from the farming to the bedside. What might be some of the healthy practices, agricultural practices, farming practices that will help preserve their potency? Dr. Saida, do you think it depends on where they grow? Have you seen that there is some evidence around that?
So definitely the quality of the plant differs from soil to soil. So any drug, when it has been produced in mass quantity for drug production, they have to have a controlled in soil environment or some other environments. So and the second thing would be like the seeds conditions. The seeds condition may vary from plant to plant, or from a series of, or the type of plant to another type of plant, even though they are same plant, but when it grow in different areas with different soil, develop different quality or effectiveness. So to prevent this, actually, I know that some of the companies, they don't grow the plants from the seeds. They use the tissue culture method, so which actually clone of one of the best plant to generate the whole plant, like a whole field of plants, so that they don't differ from seed to seed variation. So they are all do the similar activities. So these are actually very valid questions and very valid way to address this when these drugs goes for plants go for the drug production. Definitely.
Dr. Tendra?
Thank you so much. Yes, as Dr. Saida is saying, uh, the plants will vary in the chemical components, not only flavonoids, even other chemical components. So what we are doing, more research is going into it, and we are doing what is called smart agrofarming. What it means, it's just what Dr. Saida said, we plant these plants in a controlled environment, greenhouses. And also in terms of research, we want to research more on the seeds and also more on the soil that this plant grow on. So it's an ongoing research, it's improving, and we are finding even smarter ways of obtaining these seeds, of planting them in a controlled environment, so that a seed that is grown somewhere in America, and I take the same seed, I grow in the same controlled condition here in Africa, they'll produce almost a crop that has similar chemical constituents. Thank you.
Thank you both. So let me just see if I can invite the two of you as we round off here. For those of us who are not scientists, we don't do that kind of technical work that you do, but we are interested in plants and vegetables. What should be the lifestyle practice that you would suggest that will help advance this work that you all are focused on and presenting with such detail and significance? Dr. Saida and then Dr. Tenma.
Yeah, thank you very much for this bringing up these questions. So I believe we all learn from our COVID experience. So we didn't go for the when the COVID came, there is no pharmaceutical medicine available. We all went to our traditional medicine, taking herb and inhaling the air. So that's actually gives us show us that how powerful these traditional plant or spices or these help us. So I will say that yes, there is they are powerful things. So we all should um, reduce taking the processed food or with preservatives and stuff. We should consume more fresh fruits and vegetables daily, and have our food more developed with all the spices, which actually have like curcumin, turmeric, ginger. Those spices, those are also very important for anti flavonoids or any other anti-cancer or anti-inflammatory effects. Thank you.
Dr. Tendra.
Yeah, let's embrace plant-based diet. And the world has become a global place. So as much as we're embracing this plant-based diet, we are campaigning for organic food. Let us also just control what we plant. We can all have smart farming methods. We are teaching people about this education. Education can never cease to educate people on best practices ever. So let us embrace the best practices. Global Health Catalyst is having camps in every country where we are having Phytomedicine Institute, where we'll be teaching all these skills. We are partnering with normal citizens. We want to know your knowledge and we want to document this knowledge in order for everybody to know. So as we conduct this, we also talk about nutrition, about plant nutrition, and how smart ways of having these plants and how we can use to better our health. Thank you.
Let us give our presenters another round of applause for the wonderful content that they've shared with us. Thank you all so much. This is great. And let me just mention that we have next week another wonderful upcoming presentation, and I will invite Dr. Gloria to tell us a little bit about what we have on tap.
Sorry, I was on mute. I was talking to myself here. So thank you so much. It's so exciting to see, to hear all what we are doing. Where are you? Okay, here I am. So next week is going to combine the body, the soul, and the spirit, and the science of whole person health. Psychoimmunology, stress and physiology management, all those spiritual strategies we have, prayer, singing, dancing, how does it tie into our spiritual well-being? And we want to think about mindfulness, gratitude, and we know that it takes more muscles to frown than it is to smile. So how can we combine, integrate all these things that affect health, our body, mind, and spirit into whole person health? How do we do it? And to deliver those lectures, we have fantastic professors and doctors in their field. You don't want to miss that. We have Professor Otto Presley from Drew University, the Balbonis, Tracy and Dr. Michael from Harvard Medical School, and we have Dr. Glenn from Johns Hopkins Medicine. I don't know where else you want us to bring the faculty. So please don't forget, call your friends who've been in the program to join us, and it's really going to be a wonderful session. And pardon us, we are almost going to have the course, and it's been so interesting to see the interaction on board. So please stay tuned. Thank you.
Yes, and thank you, Dr. Gloria. So excited about that. I mean, I should just mention, the speakers are looking forward, and I do think there will be something unique about next week, which is that Dr. Presley he let me know he will be talking about psychosocial issues related to pediatric thyroid cancer. And this is coming out of research that he did with over 100,000 children affected by the Chernobyl nuclear disaster. So not only will he be talking about that, there is something about his discussion that will bring in a demographic that I think is really important, children. And so it's such a, so we want so invite everybody. We hope that you would come back and join us for that presentation next week. And so we look forward to seeing you. We will be in communication with you during the week just to send you reminders and share the content of today's presentations with you. And so we thank you for the time today, and hope that you have a wonderful rest of your weekend. And as our two presenters would say, get some nice spicy food to eat because it's good for you.
Yeah,
So,
yes, indeed. Yeah. Thank you so much,
thank you
everyone.
so much.
I
Yeah.
appreciate you joining
Bye.
us. All right. Bye-bye. Thank you.
Bye.